Welcome to this 1-hour video covering the IAYT Code of Ethics and Professional Responsibilities. After watching the video and passing a brief quiz, 1 CE credit will be automatically applied to your profile. The learning objectives are to understand the background behind the IAYT Code of Ethics and Professional Responsibilities, to review each element in the Code of Ethics, and to apply the principles in the Code of Ethics to ethical scenarios in yoga therapy practice. This video was produced by and for CIAYTs. Over the course of the video, you will meet members of the IAYT Ethics Training Task Force and hear voices and see photos of yoga therapists in action. 28 volunteers, each presenting an item in the Code of Ethics, and 3 volunteers discussing ethical scenarios related to yoga therapy. Let's meet the Ethics Training Task Force. Myself, Nancy Sinton, the IAYT Certification Manager. Beth Gibbs, volunteer. Zipporah Gerson-Miller, volunteer. Sarah Greco, volunteer. And Kelly Froyo, IAYT Certification Team. With additional help from Marilyn Peppers Citizen, IAYT Membership Manager, and John Kempner, IAYT Executive Director Emeritus. We'll start with a background on the Code of Ethics.
Hi, John. How are you?
Oh, I'm great. It's great to see you again, Beth.
It's good to see you again as well. So we're going to take the next few minutes and kind of explore how the Code of Ethics came into being. And I think we can start with history, because historically we do trace the Western history of ethics to the Hippocratic Oath for medical professionals and the yamas and niyamas from the yoga tradition in the East. So in your opinion and knowledge, how have these two sources contributed to IAYT's current Code of Ethics?
Well, first of all, they were in the back of our mind in everything we're doing, and sort of implicit, okay? That plus Judith Lassiter published a Code of Ethics for yoga teachers in the Yoga Journal many years ago, which was also very good. But we wanted something that was pragmatic, okay? First, something that we could take pride in saying these are our ethics, and then a pragmatic way of adjudicating, if you can use that term, any complaints. So we actually took a structure from the National Certification Commission for Acupuncture and Oriental Medicine, because it was so well done. The structure about your Code of Ethics, but then this grounds for professional discipline is a key document to tie any complaints to something that you can actually take discipline about. Mm-hmm. And then there was a complaint form, and then there was you have to have a review panel. So that pragmatic structure grafted on top of the kind of a consensus about ethics in the both Western healthcare and in the yoga tradition actually came together pretty well, I think, in at least my opinion.
Okay. And when did it launch, and how has it shifted and changed over the years?
Okay, it launched in 2016 after a couple of years of work here. Okay, right when we started certifying individuals, we started this Code of Ethics, because that's the way we could tie it. Everybody that got certified also had to agree to this Code of Ethics. Okay, so you had to have something that was linked together. You just can't impose it upon people without them actually reading it and making sure that they assign something that says they agree to it.
Okay. And what types of changes have you made over the years?
Just pragmatic ones. The first time we did it was aimed at just yoga therapists, but a lot of our members have licenses in other fields like physical therapy or medicine or mental health or something like that. And they can do things under that license that yoga therapists can't do. So we modified it to say you can do stuff that's under your license, even if just a yoga therapist can't do that.
Okay. And I know there is a quiz that everyone needs to take each time they apply for recertification. What is the reason for requiring the retaking of the quiz?
Well, multiple reasons. First of all, we take this seriously. So requiring a quiz is a statement of how important this is for our field, and of course, every field. But the main purpose of a code of ethics is really prevention, okay? And so by taking the quiz and looking at this stuff, you're just more aware of what you have to be careful about. There's some subtleties out there in codes of ethics that you might not pass the test if you actually just read it and try to use your common sense, because that doesn't always work in all the cases.
Great. Okay. And my next question is, what is the difference between a scope of practice and a code of ethics?
Okay, a code of ethics is, again, think of it as ethics like a moral code that guides your actions, okay? But a scope of practice is different. It's like what you can do and what you can't do. And the purpose was not only to inform our people what you can do, but also to inform other fields that we're not doing stuff in their turf. For example, we're not diagnosing diseases. We're not treating people the same way that a physical therapist would do, or a mental health purpose. So it's helping us to communicate to other people, other fields, but also taking some pride in what we can do, because we can assess people holistically in a way that other people can't really do.
Exactly. Now, in terms of the code of ethics, what are some of the areas that you cover, or that IAYT covers in its code of ethics?
Okay, well, some of them are pretty standard in every field. Like the big issue is, what about dating your students, okay? And basically you can't date your students. You know, if you marry somebody, she's no longer your student, okay? That's okay. And that's not a trivia issue. But one of the things, for example, in our field, sometimes people take a training course and they'll use their teacher's training materials in their own training course, okay? Without getting permission or even attributing it to somebody else. So we tried to address common issues in our field like that, okay? So it's divided into three parts. How do you treat your students or your clients? How do you treat your profession? How do you treat the public? I like the way it's laid out, kind of positive statements, okay?
Good. And how are these, I'm going to give you a list of topics, and I'd like to have you share how these are addressed in the code of ethics. Things like prevention, appropriate responses, addressing outcomes for client and therapist, and how hard and fast are these ethics? Is there any wiggle room involved?
Okay, so over the years, we've had a couple of people that have seen everything. And in the future, a whole panel is going to see every complaint here. That's educating our review panel. But the point about that is that lots of things can come up that were not anticipated. So I wouldn't use the word wiggle room per se, but I'd say there's gray areas that require some judgment. You may also say tolerance. You know, do you have a live and let live attitude, or do you have very strict, you know, all that stuff comes into play. And it's easy to be high and mighty when you're writing stuff out, but when you're actually in the middle, passing judgment on people that can affect their lives, my experience is people become a lot more humble about that situation here and try to listen. Just like a yoga therapist, you listen carefully here. So you need to preserve that room for judgment, I guess, in the practice here.
Absolutely.
But it has to be a consensus here. You know, that's part of the purpose. It's not just one person making a decision, but a small group of dedicated people are the people that will ultimately make that decision here.
And I'm sure that you do have or that IAYT has a protocol for handling professional complaints. Can you talk a little bit about how that works and perhaps if you've had cases that you've had to settle, what they were like?
Okay. So first of all, our complaint process is pretty formal. Okay. It's actually in two parts. One, you just kind of alert us that it's going to happen. And second of all, explicit complaints that ties the complaint to the grounds for professional discipline, okay? We're not a licensing agency or a business regulatory agency. We're a professional association. So we only can address things that are covered by our code of ethics and the grounds for professional discipline. So for example, if somebody thinks that they graded them wrong or something like that, a lot of business disputes, we can't address that thing, okay? But the main thing is we take any complaint that comes in very seriously. And it can take a lot of time to listen to different sides. So given that we take everything seriously, people have to complain seriously. I mean, you have to put it in writing and connect it to the grounds for professional discipline. Now, we don't take anonymous complaints. Now, if they want us to keep it anonymous and not tell the other party, we can do that, okay? But then we may decide to not pursue it because, if you have one person saying something and the other person saying something different, and the first person doesn't identify themselves, you see how tricky this can be? Because sometimes people don't want to be known, and sometimes they should be. So there's a balancing of different values in this situation here.
But it's very important, I think, that you give them the opportunity for anonymity in some form or fashion, right? Okay. And as we begin to wind up our time here today, is there anything else that you would like to share or provide information on before we close?
Well, it's one of the things that showed us as come through this is that all accredited programs have to have a student handbook that explains all sorts of things about the relationships to students. Many schools, and Beth, you probably know this, they learn the hard way over the years, okay? Yeah. So by requiring that up front, help schools be clear about what they're doing, helps the students know the process, and by doing this year in and year out, our whole field gets better at this, okay? And schools help each other. They help each other being better educators. So the process of what we require the accredited programs to do and require all of our certified practitioners to take an exam, I think it adds up to showing a concerted professional effort to promote ethical behavior throughout our organization, throughout our field.
That's wonderful. And thank you so much, John, for sharing your expertise, your time, and your knowledge today. Thank you.
Thank you, Beth.
Okay.
I will provide accurate information regarding my education, training and experience, professional affiliations, and certification status.
I will use only the appropriate professional designations for my credentials, including any designations required or granted by IAYT.
I will advertise only accurate, truthful, non-misleading information.
I will refrain from making public statements on the efficacy of yoga therapy that are not supported by the generally accepted experience of the profession.
I will respect the integrity of other forms of healthcare and other health and wellness traditions, and seek to develop collaborative relationships to achieve the highest quality of care for individual clients or students.
Now let's see how these ethical commitments play out in some real-life scenarios. Here's the first one. During a therapeutic session, a client asks, "What do you think about tapping?" That's EFT, emotional freedom technique. It's an alternative treatment for physical pain and emotional distress. Now, you personally have strong reservations about this. And in addition, you'd like to keep this client coming for yoga therapy sessions for two reasons. One is professional and one is personal. Professionally, you have seen measurable improvement in the client's ability to manage their anxiety, and personally, business has been slow. So the ethical issues to consider here: do you voice your reservations? If yes, can you voice your reservations ethically? If no, how can you respond to the client's inquiry? Do you have a protocol for making referrals in case your client asks for one? Can you ethically encourage your client to sign up for additional yoga therapy sessions? And is there a yama or niyama that can inform your response? Zipporah, let's start with you. What do you think about this?
So I think there's a couple of things going on here, which is why, ethics is such a dynamic topic. I think on the one hand, we have to be real mindful about kind of imposing our opinions about different treatment modalities and interventions onto our clients unless it is within the best interest of that client. I think there's another thing going on. And I think it's important to kind of ask yourself, is it ethical to be either demonizing, vilifying, bad-mouthing another colleague in the community or a colleague's treatment intervention or modality? I think that sends a message about yourself. So, and remember that confidentiality and privileged communication is something that you are expected to uphold, but that client can talk about anything they want with anybody. And so I think we have to be mindful whether or not we're ready to accept the fact that that client might go out and share with others that you have spoken badly about this particular treatment modality. And I think lastly, also, for me, it's a matter of self-determination. So every human being has the right to determine for themselves what is going to be the best course of treatment for their continued growth and well-being. And although we can only speak from an I-centered place. So if you've had a particular experience with something, you have to really check in with yourself and know, is disclosing that going to be beneficial to the client?
Thank you. Sarah, your thoughts?
Yeah, thank you. Building on what Zipporah shared, Socha, purity. This client says, "What do you think of tapping?" And so, in that, there's an inquiry about just, opinions. Satya and ahimsa, honesty and non-harm. And so what I would do in response to that question is ask my client, well, what do they think of tapping? Because that even means, maybe they're just exploring it. Maybe they're considering it as a therapy. Regardless of that, in this scenario, I'm not into tapping. So what I would encourage my client to do is in an honest way, tell them that tapping's not my thing. I don't know too much, and to really encourage them to go back to resources to learn more, seek out other people's opinions who do know more about tapping and have maybe received very good results, really great results from that methodology, or, maybe there are people who haven't. So I think by really inviting them to get curious and explore it more is a way to be honest and also non-harming. With that, I would see no problem in just, again, inviting them and letting them know that I do see progress in our yoga therapy sessions, and I am present to continue to help them if that's what they choose, because Zipporah nailed it. It's self-determination, and it's our responsibility to inform and really validate what our clients are choosing.
Thank you both.
I will work to promote high standards for the profession.
I will commit to working toward equitable access to yoga therapy services.
I will credit the sources on which materials are based when developing materials for training programs or publications, and obtain authorization or approval to utilize another individual's or organization's copyrighted or otherwise proprietary materials.
I will commit to the maintenance and improvement of my yoga therapy skills through educational activities and study.
I will strive to communicate with and about colleagues in a professional, balanced, and factually accurate manner.
I will provide accurate, truthful, and non-misleading information in connection with any IAYT application, requirement, or disciplinary investigation or proceeding.
I will comply with all IAYT policies that pertain to my membership, accreditation, and certification status.
Now, here are the next couple of scenarios we'd like to consider. In the middle of a particularly virulent flu season, you're confronted with finding safe, effective ways to provide service to a new client aged 60 who has a severe immune deficiency. You, as a personal preference, do not get yearly flu shots. What decisions will you need to make in order to work with your client? And here are some ethical issues to consider. Do you conduct your sessions in person or online? If in person, what harm reduction protocols will you need to put in place? If online, do you have experience with this platform? And if not, what will you need to do to prepare? Will you need to take additional training? Will you need to include specific details for service delivery in your contract or invoice as it pertains to this situation? And is there a yama or niyama that can inform your decisions? Sarah, will you start the sharing on this one?
Sure. Immediately, what comes to mind is the yamas ahimsa, non-harm, and satya, truthfulness. My first responsibility is to inform with clarity to this client that I acknowledge that they have an immune deficiency and a vulnerability there, and that I personally do not receive the flu shot. And so then I believe then handing it over, so aparigraha, non-coveting, handing it back to that client to then make the choice to be in the same space with me or to be online. Both are available, and I did receive extra training to make my sessions available online for immunocompromised individuals. In terms of having some kind of illness and still being in the same space with another person, I've learned a lot from COVID as it's happened in 2020. And, before I would just cancel and postpone my sessions, even with a small sniffle. And now I can see that that's still a good idea. And that also there are some PPEs and some hand sanitizers and other things I can put into place to even make that space safer doing what I can.
Good, thank you. Sephora, would you like to add something?
Yeah, absolutely. I think Sarah, again, really clearly elucidated this idea of non-harming, right? I really think the name of the game is non-harming. And with non-harming, harming comes this idea of transparency. To be very transparent with our clients that you personally have made the choice to not get vaccinated against the flu, and then having that somewhere in writing in your documentation, either an informed consent or documenting somewhere that you had this conversation with the client, because the reality, folks, is that we live in a really litigious society. And the last thing we want is to be held personally responsible for infecting one of our more vulnerable clients with the flu. Secondly, I think, you know, a lot of our promise, right, as yoga therapists is to provide accessibility, to have our services accessible to everyone. And that may mean offering them in a virtual online platform and space. And with that said, it does become important as a professional to seek out any kind of education or consultation that you need to be able to render your services in a professional, competent, secure, HIPAA secure kind of space. Even though we are not expected to uphold HIPAA as other medical professionals are, I think best practice is to still practice in alignment with protecting people's health information. And lastly, again, when you're sick, stay home, right? Don't go see your clients or teach classes, just as you would not want your students or clients to come to classes infected with something.
Good. Thank you. That's great food for thought. And here's our next scenario. While you are on vacation, you ask a colleague to cover your therapeutic yoga class for breast cancer survivors. Upon your return, you discover that your colleague has actively solicited your students to attend their therapeutic class. By handing out the class schedule and promotion flyer at the end of every class is one way. You are upset at what appears to be an overt attempt to poach your students. Here are some ethical issues to consider with this situation. Do you talk to your colleague? How will you approach them? Would you feel differently if your colleague made no direct solicitation, but several students had enjoyed their class so much that they decided to change teachers? And what will you tell your students if they ask questions or express concerns about your colleague's actions? And as always, is there a yama or niyama that can inform your response? Sarah, what do you think?
Beth, it's difficult to behave sometimes ethically and morally when we're hurt, right? So there's a very special challenge to this one. And so svadhyaya, self-study, I think is really important here, to really sit and be mindful to what's rising in me as I cope, as I deal and make sense of what's happened. And so then there's the relationship that I have with this particular professional, and honesty, satya, and also aparigraha, non-coveting. You know, if there are people who genuinely connected with a colleague of mine, then I would lovingly let them go, because I understand that. And we all are great teachers, and we all speak to different people in different ways. And as long as they're still moving forward and towards that easing of suffering, that's what we're here to do. So aparigraha, non-coveting.
Good. Zipporah.
Yeah, so again, like Sarah said, this is a tough one because this involves more of an interpersonal ethic with you and another colleague. Obviously, we cannot control the behaviors and actions of other people. Even when people choose to do things that are hurtful and harming. And I think we have to take a step back and try to have a little bit of compassion and understanding as to what would motivate a person to behave in this way. But I think, you know, we want to model as professionals. I think it's important to model healthy communication. And that might be to initiate a conversation or dialogue with this colleague to really be clear and gently and compassionately speak your piece to this person and just let them know how their actions have affected you. Because I think when we don't do that, we can unconsciously displace our feelings that might show up in the way we interact with our students, or maybe interactions with how we show up with those students who chose to go study with the other colleagues. So I think, again, it comes down to that daily practice, the sadhana of self-reflection, self-practice, really checking yourself and knowing when you're showing up from a place of ego versus a place of professional, professional behavior. So and lastly, I think it's a lot about boundaries too. Clearly we have to have boundaries with people, and that might be a just something you store for the future, and know that maybe next time your boundaries have to shift and change a little bit.
Mm-hmm. And all of it starts with Svadhyaya, self-awareness. So thank you.
I will respect the rights and dignity of my yoga therapy clients and students.
I will provide my services in a non-discriminatory manner.
I will keep the client-student informed by explaining practices and recommendations, and make only realistic statements regarding the benefits of yoga therapy.
I will protect the confidentiality of information acquired in the course of client care. However, disclosure is permitted to law enforcement, family members of the client, or other persons when it is believed the client presents a serious and imminent threat to self or others, or as otherwise required by law.
I will maintain professional boundaries in relationships with clients and students, and avoid any relationships that may exploit the trust of clients and students.
I will keep accurate client records.
I will provide yoga therapy only within my level of skill and knowledge.
I will provide the highest quality of care to yoga therapy clients, students.
I will make timely referrals to other healthcare professionals as appropriate.
I will refrain from providing yoga therapy to clients if I am unable to safely and effectively do so due to impairment, ergo practicing while under the influence of drugs or alcohol.
I will seek appropriate professional assistance for any personal issues that may impair my ability to practice safely and effectively.
I will bill clients and students and third-party payers accurately and fairly.
I will neither receive nor pay a commission for referral of a client or student.
I will obtain informed consent to use ethical touch as appropriate in yoga therapy session and group classes.
I will not engage in sexual contact with a current client or student after the professional relationship is established.
I will be mindful that engaging in sexual contact with a former client or student can cause egregious harm and may be exploitative of the trust established during the professional relationship. Therefore, I will exercise extreme caution in engaging in any type of personal relationship with a former client or student.
Here are a few more situations in which ethical considerations will play a role. Now, our next two scenarios are going to focus a little bit more closely on the intersection between service to the client and business practices. Your first client, your new client, has signed up for 3 yoga therapy sessions. During your written intake process, you understand that the client is expecting a cure for chronic back pain. During your initial interview with the client, you learn that this person is also a trauma survivor, something that they did not list on the written intake form. Now, you have a wealth of knowledge and experience with trauma, but you've not taken a training course in trauma. Ethical issues to consider. How will you respond to your client's expectation of a cure? How will you address the issue of trauma, directly with the client or indirectly during your sessions? If indirectly or directly, how can you be clear about your knowledge and experience? And do you have a protocol for making referrals if you decide that your client's needs exceed your knowledge and expertise? And is there a yama or niyama that will inform your decision and your response? Sarah, will you start us off on this one?
Yes. When a client comes in with an expectation for a cure, one thing that I can recognize in that moment is this client may be also setting themselves up for disappointment. And so immediately I think non-harm, ahimsa, and I think satya, honesty. Now, we may be familiar in yoga therapy that when someone shows up with back pain, there could be more going on, or pain anywhere in their body, there could be more going on. But is that ours to touch in that moment? And in this case, I don't know if it would be mine to point out or bring attention to, even if there were subtle hints that I was picking up on from the client. But that's from my background as a yoga teacher, evolved into yoga therapist. That would be the scope I would respect for myself. And this is exactly why, yes, I do have referrals of trusted therapists that I can send people when I notice this person's going to need extra support. Especially if I've asked them, do you have support network? And they say no. This is exactly why I have cards and I have colleagues. What's wonderful is that often somebody in a lot of pain is working with other people, but that's not always the case. So I would ask more, and I would be really honest, and I would seek to not only prevent myself from incurring any harm to this client, but I would also try to coach them around self-harming with disappointment.
Good. Thank you, Sephora.
Yeah, I think there's a difference between being trauma informed and trauma trained, right? So as Sarah said, you know, a client coming to you expecting a cure is not within, nowhere does it state anywhere, right? Or I'm assuming it doesn't state anywhere in on your website or your marketing materials that you offer a cure, right, for back pain. And so I think though you can treat your client with back pain in a trauma informed way, and not be doing trauma-based work. I totally agree with Sarah as having a list of referrals handy that's readily available, because one thing we know about clients is that if they do not have the resources in their hand when they leave, chances are they may not seek them out. So always having a list of trusted people to just have readily available for your clients, keeping in mind your scope of practice, right? Is this within my scope of practice? And if it's necessary at some point, you can always have that client sign an authorization to release information so that you can speak with their other providers, so you can have more of a comprehensive treatment team approach. And the last thing I'll say is, we really have to rely on our clinical judgment a lot of the time, right? Is when is it time to refer somebody, right? So if you're working with them on their back pain and they continue to, it's just a lot of talking and sharing about this traumatic experience, really using your clinical judgment that it might be time to refer.
Okay, great, thank you. And we have one more scenario to discuss. Your therapeutic yoga brochure has a clearly stated discount payment policy for sessions For example, you offer 4 sessions within a 2-month period for $240. Now, this is a discount from the full price of $80 per session, which would be $320 for the 4. You've encountered an issue with 2 clients trying to extend their session cards, even though the time limitation is one of the reasons for the discount in price. When you hold to your position and refuse to give a time extension, one client accuses you of being too commercial and says, "I thought yoga was about being spiritual." Another doesn't use their session card during the time period and asks you for a refund. You believe that you have structured a fair fee and payment policy to serve your clients and conduct a successful business. Ethical issues to consider. How can you respond to these 2 clients? How might you reduce or eliminate the incidence of these uncomfortable and difficult situations in the future? Will those plans involve a reconsideration of your payment policy? And is there a yama or niyama that can inform your decision and your response? Sarah, we'll start with you.
Yeah, thanks, Beth. This is a great exploration because in this situation, it's about livelihood and it's about non-harm towards self as practitioner. And also there is honesty there. There was an upfrontness of these are my packages and this is why I'm offering this package. So the honesty's in place. The livelihood's in place. But then there's this backlash of expectation and altruism as opposed to, really valuing time for the livelihood and the energy and the education it takes to be here. So this is tricky. Responding to the 2 clients, I think here for me, Satya, honesty, self-respect, asteya, not stealing from myself, but also not stealing from them as well. And so I think about harm reduction here, like how could I, one, maybe engage those clients to saying yes immediately to those sessions and get the value right away? Because if I can create a relationship and connect with a new client who's then now going to come back for more, that's fantastic. And that will build my business. So there could be an opportunity there. But they might not say yes to that opportunity, in which case there may be a break, like where I'm not going to see you and I'm not going to come ever. And then also harm reduction. What will that person feel? And what will they say out there in the public about my packages and my policies and the way I conduct business? So I would take that into consideration too, and really be present with those clients to see where they go with it, to try to find a compromise and a resolution that works for both of us. In that, I realize I might have to bend a little bit, but fortunately I practice yoga, so I'm very
Very good. Zipporah, I know you have a few things to add.
Well, and I think this is one thing, again, this is the joy of ethics, right? There's never a right or wrong answer. And this is, it always depends, right? There's one thing we always say, don't have sex with your clients and students, and everything else depends, right? And this is why it's important to have these conversations with our colleagues, because this is the way we're going to arrive at the best course of action. I think there are a couple things going on, right? This is a really dynamic case. We have, as practitioners, every right to clearly state what our policies are on our, in our paperwork, wherever you have that stated, whether it's on your website, your intake paperwork. We have the right to clearly state how much we charge, when that money is collected, what the no-show policies are, what the refund policies are. And maybe it's a good idea to have a legal person just look that over and just to make sure that everything is clearly stated, so there really can't be a challenge in that, right? So again, we know things happen, life happens. Sometimes people lose their jobs, they're no longer able, it's a matter of them keeping their lights on or continuing to train with you or work with you. And so I think we have to remember that, right? Like it becomes, again, like we have to go back to ourselves and what is our truth in this situation? Is it necessary to be in this power struggle with this client, or is it easier to kind of make an exception, right? And sometimes we do have to make exceptions because, like I said, life happens, right? But I also think that there is a difference in our community between what constitutes a therapeutic relationship versus a student relationship, right? Purchasing a package for therapy students may not be the best practice because within that therapeutic relationship, there is autonomy, there is sovereignty, and clients do have the right to withdraw from treatment and terminate at any time without any penalty to them. So you might want to rethink that in terms of students versus therapy clients. There is a little, the relationship is a little bit more nuanced. It's a little different. You know, there is a wonderful practitioner in our community by the name of Amy Wheeler. I'm sure a lot of you are familiar with her, but she had a little graphic on her social media the other day that talked about structure plus space is where the prana flows, right? And so when we have too much structure, there's rigidity. And when there's too little structure, there's no boundaries. So it's really, I think, about finding that harmony and what's going to help your prana flow
Good.
in the most abundant way.
Yes. Well, thank you, Sarah, Zipporah. Your contributions to this discussion have been invaluable. You've given us all a lot to think about. Thank you both for sharing your time, your thoughts, and your expertise.
That concludes this video on the IAYT Code of Ethics. Don't forget to take the quiz. The next step is to take the quiz to obtain the CE credit. That's required for recertification. You'll find the quiz on the IAYT website, go to the Education tab, and go to Professional Development, Ethics Trainings, and click on Ethics Video Number 1. After passing the quiz, 1 CE credit will be automatically added to your profile. Additional ethics information is on the website as well. The Code of Ethics and Professional Responsibilities, the scope of practice for yoga therapy, the grounds for disciplinary action, the procedures for disciplinary action, and the ethics review panel. Much gratitude goes to the Ethics Training Task Force volunteers and the IAYT members for your time and creativity. The 28 CIYT volunteers for lending your photos and voices to infuse the Code of Ethics with vitality. And to Phoenix Rising Yoga Therapy for your organizational tools, which help the Zoom sessions go smoothly. And of course, to all the CIYTs for your commitment and passion to maintaining ethical values in yoga therapy. Thank you for watching.